Awesome, guys. Welcome to another episode of Just Chatting About. Super exciting to have Rehan and myself on this podcast. But I see there's someone new to this, and this is probably one of the first times that we are introducing an outside speaker. I will let Kieran Drew, introduce himself and tell us a bit about what he is doing right now, what he was doing, and yeah.
Okay. Yeah, it's good to be here. I didn't realize I was your first external speaker, so no pressure, huh?
Yeah.
But yeah, at the moment I am writing online. So I have been doing that for about 1 year now. And beforehand I was a dentist. So I'm actually in the process of making the transition from teeth to words at the moment.
Okay, awesome.
That's cool.
So teeth to words, and we found you on Twitter. Could you explain a little bit more on? So obviously, like most of the people that are listening to this, they might know that I made a similar transition, say from teeth to words too, and also exploring the potential of the tech world. And I see that you also have a certain interest there, with your because of the insights that I see on your Twitter, etc. So let's address the elephant in the room. Most people know my story, but what's your story? Cutting straight to the meat. Why would you leave such a high-paying job, such a high-potential job? And I'm pretty sure, just like we Indian parents and aunties have, who look at someone, making this transition, there might be those, British aunties and parents, etc., who look at you and be like, Kieran, why are you making this plunge? So why the plunge? Why leave, say, the most highest paying job in the world to become, say, a writer?
Yeah. Well, it's funny you say that. I'm actually visiting my mum at the moment, and she thinks that I'm losing my head. But to me, I guess starting with why to go online. For me, it's something I noticed about a year or two ago when I realized that the actual potential of what you can do online is really great, and I feel like that's something that is actually in its kind of infancy as well. So one thing that always really appealed to me is that if you have good ideas and you're able to communicate it effectively, you can in essence reach millions of people for doing stuff that you actually enjoy. Whilst with dentistry, like you were saying, it's definitely not a bad career. You get paid a lot. You get respect for it. There was always that sort of thing that it felt quite capped. At the end of the day, you work with your patient. You maybe help 20 people in a day, and when you kind of put that into the grand scheme of things, in my opinion, going online is just something that's 100 times more exciting.
Okay. Rehan, any questions?
Yeah, so for me, firstly, I just want to point out that it's pretty rare for more than one Indian to be involved in a conversation and the engineers to not be in the majority. It's quite surprising. But so considering both of you have been doctors, in the past and have made that sort of plunge and shifted careers, I wanted to actually understand what was the thought process that went behind picking the dentistry as your path in the first place. So I wanted to understand that from both of you, how is it that your schooling, the influences that, or is it society, or how does it work? How do you end up picking that in the first place before you actually, decide to transition to something else?
I think, Kieran, you can start.
Well, for me, the dentistry side really came from my parents, mainly my dad. Not in I think you guys probably get a bit more pressure for this stuff. But I remember sitting outside a dental practice when I was 14, and there was a big queue of people, and my dad was sitting there, and he was like, "You see, that's how you make money." And so from an early age, I was always like, you get a dental degree, you're going to make a very nice kind of paycheck, which I know isn't really the right reason to go into stuff, but you don't know that when you're kind of younger. That just seems the very much the done thing. From about 16 years old, I decided to go from it, starting from that reason.
Also,
So
Kieran, one quick.
primarily the idea of money, is it?
Yeah, I mean, it started, the spark started with money, but then when you get to school and you tell teachers that you're going to be a dentist, even school teachers, they encourage it because it looks good on the school to have a certain amount of doctors and dentists graduating there. So I remember, 16, 17, you were kind of not precious so much, but like your young identity and your accomplishments are wrapped around what you've told
Right.
other people. And so by the time I was 18, obviously the money was something that I still wanted. I wanted to get paid, but it was also, you're like, oh, I'm going to be a dentist, and that's something very impressive because people tell you that it is.
Right.
Cool. So,
Nelson?
Kieran, just to probably rephrase it or paraphrase it once more, dentistry is one of the best jobs there, or highly regarded, at least in terms of status.
Yes, yeah. Dentist, doctor, lawyer are probably the sort of big three classically. Particularly from older generations. So yeah, definitely.
Cool. And it is one of the highest paying jobs there, right? I'm asking you this. Say I'm a 16-year-old,
Yeah.
a 16-year-old Indian kid, or a 16-year-old kid in UK. And I'm looking at, I have no idea, right? Probably similar to how you or I was. We don't know what dentistry is like. Now, there is this notion that dentistry pays well. I'm just trying to cut down or slice it in terms of actual figures. How much would, say, a dentist make in the UK?
Yeah, I mean, the pay is pretty good, but I would say that there is significantly easier ways to make the same amount of money. When you look up dental paychecks, you'll always notice online that there's a very big range. So it would say something like 60,000 to 200,000, and then when you read that, you don't see the 60 yet. You see the 200, and you think, I'm the one that can make that. So I would say that, like, particularly among my friends, that there's definitely a wide range of how much people are earning, and it really depends on what side of dentistry you get into. But I would say that, like, if a 16-year-old asked me what job could I go into just to make money, there would be a list of 10 other things that I would say to do apart from dentistry.
Okay, got it. The reason I ask you is because in India, it's slightly different. So, I mean, doctors and dentists, they get paid okay, but it takes quite a time to reach there. And in your early years, so there's that gestation period, and in your early years, it's actually one of the least paying jobs, right?
Okay.
Yeah, that's the reason I ask you to understand that parity or that difference. So early days, because there's a huge supply, it's almost like dental colleges are just minting. So it's more profitable to teach dentistry or, become a dental college than to actually do dentistry, because there's so much in supply. And demand is also, obviously it's there because, say dental caries is the most common or most infectious disease out there, but the market penetration is not that much. Most people don't recognize the need of dental care or dental hygiene, and so it's more like a okay to have rather than a must have or good to have, right? We go to the dentist only if it's unbearable pain. Is that also the situation there? Or because from my understanding, I don't think dental clinics are part of the NHS, but it's still compulsory or it's part of the insurance or something like that. So could you give some clarity on that? How important the market is? Yeah.
So dentists are part of the NHS.
Okay.
But it's not a free part. So we're used to free medical care. The dentistry they pay for, but it's quite heavily subsidized.
Okay.
In terms of the demand, there's definitely a shortage of dentists, which is probably why we get paid okay here. There's still that element of a lot of people only come when they have to.
Right.
Right now, I would say that there are a lot of people that are aware of dental treatment, and that awareness is going up. So people are a lot more kind of proactive, but there's still a large part of the population that come when something hurts and they'll get it treated and then they disappear again. So like America is a lot further ahead than us. You guys are probably a bit further behind from that side, and when we're in the middle.
Cool. One other question that I have, say for someone who has completed their dental graduation, someone say like me, right? And one of the things that obviously, because I mentioned from the previous statement that, you know, there's a lot of supply, one thing that we look at is, hey, let's go to the US or the UK where there's a demand, right? Now, I know that it's difficult because there are a lot of exams. Say in the UK, I think it's called the ORE, and the US is the NBD, etc. What's the, like, I'm assuming you have a lot of Indian friends too, or you know some Indian dentists. What's their lives like? So after they say finish their dental college in India, what were their next steps, or what do you know about how they carried it forward?
Yeah. I mean, to be honest with you, the people that I know that have come from India, only one of them has so far become a dentist. Three of them have actually had to become kind of dental nurses. You have to take a step down, and then, I mean, like you're saying, there's more exams from there. But then it's actually quite tough, you know, because the bosses, they're looking for dentists that are English. And you know, if you turn up with a strong accent, there's already a little bit of a red flag, because when there's a problem with a patient, it's 90% communication. And you could be a great dentist, but like, and people do it all the time, they judge a book by its cover. If you come in and you're an international person, it's actually quite hard to get a good job.
Right.
This is actually quite surprising for me. I mean, you know, for me, it's a fairly common understanding in India that, you know, any engineer's destination, or if you ask them where they would like to work, is not going to be in India. So as soon as you know, do your graduate studies, I think, you know, the goal is to go to the US or to Europe, do your masters, and probably start work there. I'm quite surprised to you know, hear that this is something that, you know, is common amongst you know, people who study dentistry or medicine in general as well. But the thing that is common that does end up happening for engineers when they go abroad is that there is a disparity in terms of the pay, right? I mean, people do see, although, I mean, these are people who are specialized in whatever they do tend to get, let's say, paid a little less than their counterparts who are natives to that particular country. Is that true for dentistry as well? Do you think that is something that would happen?
I think it would happen, but not so much intentionally. At the end of the day, the NHS payments are the same. But, you know, in terms of the uptake of treatment, definitely people would rather see like an English dentist, and then you pay them more, sort of thing. So yeah, then there would be a pay discrepancy. And I guess if you're internationally coming in, it's not something you're really going to complain about. Because you can't really, can you? You don't have a leg to stand on, sort of thing, unfortunately.
So,
exactly, yeah.
One question I have is, say if you come in as a dental assistant or a dental nurse, how much do you think they would roughly make? A broad range.
A dental nurse is about 18 to 20,000 pounds, I think.
Okay, so that's like 3 to 4 times lesser than a dentist. So not just in terms of the actual work that they get to do, but also in terms of the pay, right?
Absolutely, yeah.
Okay, one question I'm pretty sure a lot of people might have right now, because we threw the word NHS out there. Could you probably just explain NHS in, say, 2 lines? And because in India, we don't have a system as such. It's not a formalized system, or the government does not, nothing's formalized, right? It's dentistry is private practice. You can maybe practice in colleges, but most of it is private practice. Right now, we are coming with things that are similar to, say, a DSO. But other than that, there's nothing institutionalized. So could you tell us what is an NHS, and with the insurance setup, maybe in just quick 2 lines, because I know there's a lot of complexity there.
Yeah. Well, in a nutshell, the NHS is a state-funded healthcare system. So in essence, you don't pay for any medical treatment, and you pay that with your taxes. And then basically you get access to anything healthcare-wise. Dentistry is like a partially subsidized one. So the NHS pay dentists, and then the dentist charges the patient. But yeah, so it's basically free healthcare, but obviously I say free, you pay with taxes.
Okay, awesome.
Right. So Elson, I mean, you know, the sense that I get here is that there's something that is building in your head, some sort of calculations that are going on. So I just wanted to understand, why exactly have you been asking these things, and what exactly is the thought process behind trying to understand these questions?
The main reason that I'm asking you is this because I've had these questions. When I was, say, an 18-year-old, or even after I finished my college. Like, one was just before entering college. What is the scope of it? Because my story is somewhat different from what Kieran had. So my mom's a dentist, my uncle's a dentist, my aunt's a dentist. I've had a lot of godparents in the field of dentistry, and I've seen how it is. And I've had a lot of dental treatment, right? So I had like a Delaire face mask. I had like 2 sets of brackets, a lot of it. And because of like orthodontic treatment, all sort of things. So I was around the field quite a bit, switching between dentists, knowing all of this. But I never really knew what to look for in a profession, right? When I finished my 12th grade, I saw a lot of my friends, they entered into some coaching institute. They were studying for their engineering or their arts or pursuing something. But I didn't know how to look at it. What is the things that you look for in a career? I assumed dentistry paid well. So I wasn't looking for pay at that moment. I didn't know that was the way to go about it. Second, the one that attracted me most was the status, right? Because my mom would sign off with the doctor tag before her name, the preface, and I would see patients come, meet us here at a supermarket or a hypermarket, while we were going for shopping, and they'd be like, "Hi, doctor," and there was a smile on their face, which I didn't see, say, with the other professions like accountants or engineers. Okay, that's what I saw, and I was like, "That's so cool." So when the time came, I was like, "It'll be cool to have like a doctor tag, prefaced." That's the reason that I entered. But as I got into the field and I realized that, hey, there isn't much of a demand in India, or the demand is not yet recognized in India, and unfortunately, it looks like there's a lot of supply. The math side in me told me, should I explore other options? Should I go for my master's? Should I go abroad? And one of the options that many people, when they try to go abroad, is they either enter into, say, public health, because they cannot, probably get the license while going abroad, or they become, say, dental nurses or dental assistants. And I was curious to know, what are the actual numbers? Because we hear that, okay, go abroad and you pay a lot. It pays really well. But I wanted to know, slightly more hands-on, zoomed in, how it actually looked like. So that's the reason for the questions. Kiran, one question that I have, since I spoke about college life, what is the college life there, especially in, say, a dental school? And also, have you, it might be difficult for you to answer. When you compare, like I don't want to actually bias that. So let me ask you, you might have seen, say, a foreign dentist, right? Work, say, in a college or in a clinic. What is their level of expertise? I know we are not supposed to compare dentists, but I think you can make some broad remarks on that. Do you think that when they first come in, they're equally equipped?
I've only met a few, so I guess it's quite a broad generalization, but not really. I'm not so much confident with what they're doing, but also generally as competent as British dentists. So.
Okay. So one last question that I have in that same space is, how expensive is dental school?
Yeah, so dental school, I was the last year where it was cheap, or cheaper than other people. Right now, I think it's about £50,000 to train.
Okay.
So yeah, about £10,000 a year, and then the last year the NHS pay for it.
Like an internship,
like an internship. Yeah.
Okay, awesome. So £50,000 for how many years is it, and what is the degree that you finally get?
So you get it depends which university you go to, but I got a bachelor in dental surgery, and that was 5 years start to finish. And then after that 5 years, you have 1 year of like a training year where you are a dentist, but you're also still learning. And so you could say it's 6 years of training, but you get paid in the last year, so that's not so bad.
Right. And with that degree, the BDS, because that's the same degree that we also have. With that degree, is it easy to get a job, or do you have to go for, say, master specialization, super specialization, something like that?
No, easy to get a job. Well, Some people didn't because the NHS struggles to fund as many jobs as they would like. But you don't need to kind of do any more further education unless you are applying to clinics that are quite higher end. So like basic dental practices, they don't ask for any, but quite a lot of the practices that you want to work at, they'll say you have to have done 2 years post-grad training and this course sort of thing.
Okay. And do people get into academics, research and academics also, or mostly just set up the practices?
Yeah, some people go straight into that side of things. So you either become a dentist in like normal life, or you go back into dental hospitals,
right?
And go down the kind of more academic educational route.
Okay, awesome. I know that sounded a little bit like an interrogation, but I think that would really help a lot. The 16-year-old or the 23-year-old Elson would really have appreciated that. Cool. That's it.
Turning into FAQs for a future applicant.
Right. Now that's kind of like what I intended. I just wanted it to be crisp because there's a lot of bullshit out there. Pardon me to all the audience that is listening to us, but I had to put it right because when you just do a simple Google search, there's a lot of fluff. And I think you really mentioned it, or you hit the nail on the point that it's a range and there's a minima and a maxima. So notice where you lie, right? Rayan, any final parting thoughts?
Yeah, it's again like a question to you. So after you hear this, right? Considering that there's a range as well, 60,000 to 200,000. Even if you were to take the lower as our benchmark, if you were to compare that to, let's say, the Indian pay for a dentist, would you think it, I mean, from whatever you've heard today, do you think it's still worth it for someone to probably want to go abroad and start practice there, or work their way up as an assistant first, or a nurse first? Or do you think that it's better that they continue focusing on probably doing their masters here? Or what exactly are your thoughts about this?
Right. So to give a little bit more clarity, dental school is expensive here. Dental and medical school, very expensive, especially comparing, even if you do the purchasing price parity. So it is very expensive. You shell out a lot, and then even your masters gets almost insanely expensive, right? People give up their entire fortunes, get mortgages, etc., student loans. Not as bad as the student loans, say, abroad, but it's quite a significant sum. And after that, the worst bit is when there's no demand, right? So I've always questioned people who take up the field of dentistry for money, because it takes a lot of time, and once you start comparing it with your colleagues, it starts to hurt a little bit. So be smart about it, and I think that's what we can explore, why you should actually take up dentistry. If you're doing it just for the money, maybe not the best thing to go about it, because it becomes linear. It is a service business. And I think Kieran also mentioned that there's a lot of smarter ways that you can start making money. So if money is your only goal, I wouldn't recommend it. Would I go abroad? This is another aspect. Even after your 5 years, you come up with the degree, you have that crown on your head, and you assume that, hey, now I'm extremely employable, I'm a doctor, I have that status. The big problem here is, you are not very employable, right? Say I wanted to switch my profession. Now, I have recognized this problem. Say that I have recognized the problem that dentistry doesn't pay well in India, or that it doesn't pay well abroad. Because I've invested, say, from the schooling ages where I'm studying, say, biology, and then further on going into dentistry, there's too much of a sunk cost fallacy. And also you haven't explored other fields, right? I was, say, a black sheep when I decided to explore other fields, but not many people do that. So they're actually stuck into making a choice. They don't really have an option, right? After, say, putting in 5 years and realizing that I have no other skill, what do I do next? So it makes sense that some people then assume that, hey, the best option left is going abroad. But I want people to recognize that there's probably other better options too. And yeah.
You say about the whole moving abroad thing. I think it's Warren Buffett that says if you find yourself in the hole, the best thing you can do is stop digging. And that whole moving abroad is like another huge commitment that
exactly.
You think about get out. You're making it 10 times harder.
Exactly. In India, if you get into a government dental college, it's free. But getting into a government dental college is insanely hard. Say like an IIT.
Yeah.
If you go into a private college, anywhere between 10 to 20 lakhs
10
INR.
to 20K
20 lakhs.
for him. I mean, I was just
Right. So 10 to 20K. And that's your BDS. That's your undergraduate degree. But the big problem is with your undergraduate degree is pretty much useless. Right? You need your masters because, like I mentioned, the supply is huge. Now people are looking on how can I do better. So going for masters is become a compulsory. And if you do that, that will cost you anywhere between say 30 lakhs to 50, 60 lakhs.
Oh.
Yeah. So
right.
overall, if you do the math, like it's going to be again around 80K. But the problem is you're not really making much out of it. Right? It's saturated.
So what would your first salary be as a BDS, and then if you do your masters as well, what would your first salary be?
So
At what
BDS.
stages?
So in BDS, one reference that we can have is say what a college pays you, right? For say a lecturer or a junior dentist, the best colleges pay say 20K. The worst colleges pay maybe 2 to 3K, or
No, so wait 1 second. I think his 20K is Indian 20K.
Indian 20K. Yes.
That is just about 200 pounds.
Yeah.
No, really?
Yes.
Yeah.
So that's
Wow.
that's what a dentist makes, and though that's the best college, right? That's what the
200
top.
pounds a month.
Yes. And if you go for a private practice, you might end up spending like 1 to 2 years getting nothing. Maybe like just or maybe a 5K. So a lot of the times it's like, hey, you get to shadow me as a dentist. You get to shadow my clinic. So it's an apprenticeship. So you learn your skill, craft, improve your dexterity. So sometimes, yeah, you put it right. Yeah, exactly. So sometimes that also tends to happen. And after you finish your undergraduate, you say you finish your masters. Again, I'll give colleges as a reference. I would say maybe like a 50 to a lakh. That is your base, or that's how much you can expect. But now I want to also give you like a little bit of a rosier picture. I have seen dentists earn close to 4 to 10 lakhs per month too, with just a small clinic that's the size of say a washroom. So even it's such a small place, people do make money, but that's like a very, very isolated incident.
So
But yeah.
after the masters, you're saying it ranges between, let's say, 6K pounds to about 48K pounds at best.
Yeah. I mean, you're better at the conversion, but yeah, something like that.
Yeah. Damn.
But that's
Mad.
the reality. So, I mean, the worst part is, like I mentioned, there's a lot of investment, cognitive, in terms of how much you study. And like I mentioned, like people who get into dentistry or medical profession, they're not dumb. They're in fact probably the best students from their school. And that's, I think, the reason that Rehan
definitely.
also asked. The main reason Rehan asked you, like, what was your background or why you got into the field is because, like, most of the dentists and doctors that I know, they were like the toppers in their batch, right? And that was like so this was the best option that was put forward to them. They were like, become a doctor because you did really well in your studies. But that's suddenly you start digging the hole, and midway through you find out, hey, that was actually not true.
Yeah.
So that starts to hit.
It's a shame because if you've got that potential at 16 to 18 years old and you put the same amount of effort and the same amount of money into something else that maybe doesn't force you into a commitment, like you probably could achieve quite a lot if you manage to get into dentistry, but you just don't get told that, right?
Yeah.
Yeah. Another reason I asked that was actually because in India, there's very little awareness about, what is actually out there. So even if it is, let's say engineering or medicine, which are the two most, taken paths, there's very little that you know about what it is actually like, before you actually start studying that, or if you even start before you start work. And apart from that, what else you could do, there is little or no knowledge that a student has. So unless, let's say, you have an elder brother who's an outlier who decided, or elder sister who's an outlier who decided to do something different after they've already graduated as an engineer or a doctor, you'll have very little understanding of, the things that you could potentially do apart from these two paths. I wanted to kind of understand if that's the case there as well. If there are sort of set paths between which most students choose from, or is there, let's say, a clear understanding of what all is it that people could do, and then you probably, let's say, make a decision which is either pragmatic like you did, which is based on the kind of money that you would make, or you have a clear understanding of this is something that I am passionate about, so I want to be a designer, or I want to be something else, pursue something else.
Yeah, I mean the education system isn't bad for this. They do kind of give you quite a wide scope, I would say. From what I remember, it was a little while ago now. But I would say that I think this is maybe kind of global, that it's pretty fucked up how at 16 you say, oh yeah, I would like to be this, and then they would hear what you like and tell you that you like that.
Yeah.
And also, like you guys know, that it doesn't matter at school, they will never talk to you about the digital side because they don't know it.
Exactly.
If they knew it, they would be teaching. So there's that as well. Like you get a very classic path of what you want to do. Like if you're quite artistic, you'll be encouraged to take a designing job. People get told to go to the military. A lot of people become teachers, which is just like, you go to university to learn how to teach the same thing, right? It's a bit of a cycle, but sure. So for the Indian dentists out there listening, after I've heard what you guys are getting paid, yeah, I would say that if you're very passionate about the idea of teeth and helping people and being very specific into your job, and money is way down in your value list, dentistry might be okay for you. But if you're not sure, and if you're going in it either for money or family pressure, these sort of things, in 10, 20 years, you don't think about what your parents are thinking. You think, why the hell am I here? So really explore your options early before you start digging that hole.
Awesome.
Yeah.